From Eyewitness News, this is Breaking News.
And good afternoon. We interrupt your programming with some breaking news just into the Eyewitness newsroom right now. The Governor, Don Kachiri, and Dr. David Gifford from the Rhode Island Health Department joining us for a news conference to discuss the latest on the swine flu. It's just getting started. Let's listen in now.
Yeah, I know. Okay. All right. Good afternoon. Let me acknowledge you're going to hear from in a few moments Dr. Gifford and Superintendent Phil Thornton. But we have here Lieutenant Governor Roberts is here, Colonel Doherty, General Bray, Dave Smith, head of EMA rather, and Peter, Dr. McWalters from Department of Education, and I see a lot of members of General Assembly out here. Earlier today, I was informed by Dr. Gifford that a student at North Kingstown High School is being tested and monitored for possible swine flu. Department of Health last night actually sent a sample to the Centers for Disease Control and Prevention for further testing. Normally the protocol is that those results will take 24 to 48 hours. In an abundance of caution, I have recommended that the North Kingstown school officials suspend classes at the high school through the remainder of this week until the state receives the results of further testing from CDC. We know that the individual visited Mexico with family during the school vacation. Upon return, the individual presented flu-like symptoms and was treated by a local physician. As more information on swine flu came out from the CDC, the physician, to their credit, suggested the individual be retested. The test performed by the Department of Health indicated it is a flu virus, but could not confirm the strain. It is standard protocol for probable causes, or cases rather, to be sent to CDC for exact typing. At this time, no family members have presented with symptoms, and no classmates appear to be ill. The North Kingstown Superintendent Phil Thornton, who was here, and you're going to hear from him in a few moments, is here to answer questions, but has confirmed that classes at the high school will be suspended for the remainder of the week. All home and away sports and after-school activities are canceled effective this afternoon. This is a very rapidly emerging situation, as you all know, from all the reports coming out of the national press and around the country. In just the past few hours, we have learned of two confirmed cases of swine flu in Massachusetts, with additional probable cases throughout New England. The Department of Health continues, and I want to emphasize, continues to work with local, regional, and national officials to closely monitor this situation. The Department of Health has access to all of the resources it needs to manage this situation. It is critically important that the public be informed about swine flu and vigilant in practices to prevent infection and spreading, including washing hands, using sanitizer, coughing into your elbow, and all of those smart, sensible protocols. If anyone is experiencing flu-like symptoms or not feeling well, they should stay home from school and or work and seek medical attention. The suggested CDC protocol, should the case be confirmed, I emphasize should the case be confirmed as positive for swine flu, is to close the impacted school for 1 week. No decision will be made to further suspend classes at North Kingstown High School or any other school until the state receives the results from the CDC. So that's the situation, that's the status right now. As I said, it's changing dramatically, evolving as we go. I want to emphasize the individual who is being tested, I want to say that was not seriously ill, appeared to come through this with typical flu symptoms, so it wasn't a case of requiring hospitalization or anything like that. But as you know, there are right now stories of incidences around the country where there have been more serious consequences. Right now, that is not the case with this individual, or as I said, anyone in their family. We are taking this step out of, as I said, an abundance of caution. You can see what's happening all around us, and as I think we will see in the ensuing days, this will become more prevalent. But I'm going to ask Dr. David Gifford, who is the point person. Those that have followed this know that in our emergency management response plan, under the direction of the General Bray, who is responsible, and David Smith, who heads emergency management, but as to what we call a pandemic plan, or a plan to deal with a health issue that is significant and rampant, part of that plan calls for Dr. Gifford and Department of Health to be the primary focus for this. And so David has been on this since it first broke out nationally, since the news began, which was last week, has kept me briefed all through the weekend and every day in terms of the status, because it's been changing rapidly. So David, why don't you come on up here?
Thank you, Governor. I think, as the Governor said, we've had a large number of reports of influenza-like illness, given everyone's concern. Most of them have not required any further investigation. I think, as we reported yesterday, we've tested a little over a dozen samples, and one of them came back suggestive of a possible swine flu, so we have sent that to the CDC. I'd like to emphasize that in other states where one has not seen much swine flu, some of these tests come back negative for swine flu. There are other versions of flu that are circulating out there. So we do not know. This is not a confirmed case of swine flu. This is one that we are suspicious of and have sent it down there. So out of an abundance of caution, when we informed the school district of this to get more information, we elected to recommend, and the school agreed with that, to suspend classes until we get the results back from the CDC. Again, I think the Governor issued, we've been out talking to the family, friends, as well as classmates of the student, and we have not seen any of them ill or anything suggestive of any illness that are out there. So we're doing this again out of abundance of caution until we get the test results back from the CDC, because, as the Governor said, the current protocol recommendations from the CDC are that confirmed cases in schools would result in school closure to try to minimize the spread that is out there. Again, we're not concerned about other schools in North Kingston. We're not concerned about other issues out there. We continue to get reports from around the state of anyone who has any influenza-like illness. We are not seeing any huge outbreak-type numbers or anything that makes us worried that something is spreading around. I think what's most concerning to us is the numbers and stuff that we're seeing in other parts of the country. And so I think what we're doing is taking a very proactive step here to minimize the spread, so we are as best prepared to prevent any illness as it comes along in this state. Clearly, there are now confirmed cases in Massachusetts. Actually, while the Governor is speaking, I got a quick text. There's a confirmed cases in Maine now, and we're seeing confirmed cases in a number of other states around there. And we will continue to see confirmed cases throughout New England and the rest of the country, and it is just a matter of time before we get a confirmed case in Rhode Island. As I've said before, one confirmed case does not change what we're doing. The recommendations are still to, if you're sick, stay home, cough into your elbow, use alcohol, hand gels, or wash your hands. We know how influenza and swine influenza is transmitted. It is transmitted by people touching their nose, touching their eyes, coughing into their hands, and then shaking hands with someone else. That's how it spreads. We are not concerned about the school itself. This virus does not live outside the human body for very long. So after a very short period of time, we're talking about minutes to minutes, the virus is dying. There's no need to sterilize any process of that. Certainly if someone touches a surface and you go along and touch it right after them, that is another vehicle that can be transmitted, but that will be certainly not a problem with the school being suspended for the next 2 days. Again, if people are feeling ill and they have cold-like symptoms or flu-like symptoms, and they would not normally go to their doctor or not normally go to an emergency room, we're recommending they stay at home, rest, and drink plenty of fluids. Certainly, if they are feeling ill enough that they need to seek medical care, we recommend that they seek medical care. And certainly any pregnant women or children younger than 5, we are asking that they seek medical care because those individuals are more susceptible to any influenza-type process. That is our normal recommendation. But as always in these circumstances, it's worth highlighting what we normally do because we sometimes aren't as vigilant as we need to be. I will turn it over to the superintendent, and then I think questions after that.
Sure. Okay. Yeah, that's fine. Thanks, Giff. Yeah. Let me just say that you know, in Dr. Gifford's role as leading this effort, you know, often, and we saw this, we've had a couple of incidences. Remember, I think it was a year or 2 ago, we had the outbreak of encephalitis, and we had some concerns, and it was in school. It was school-based. Heavy coordination with the Department of Education, Peter McWalters and his team, because it's working through that network that then we reach out to the districts. And that's what happened in this case. And Superintendent Phil Thornton, superintendent of North Kingstown Schools, came in late this morning and reviewed the situation with him, and I'll let him comment on that. Phil.
Sure, just very briefly, we are taking all precautions. As of Monday, CDC protocols were sent out to all faculty and staff on flu. All hand wash stations have been confirmed as being refilled in district, and we are working closely with the health department as we go forward. So at that, we can certainly take questions if you have any questions. This morning at approximately 9:30 a.m.
What is the age and the gender of the student?
It's a high school student.
Yeah.
High school student.
Yeah.
Did you dismiss classes right away as soon as you found out at 9:30 this morning?
No, why don't we let's get some order to it. All right. Go ahead.
He found out when he received a call from our office to come to our office to work out the situation. We are still in the process of collecting additional information about that. The decision was made close to around 11:30 or 12. School was already being dismissed at that point for normal process at 2 o'clock. So that's it. We are not concerned that there's any spread. This is, again, out of abundance of caution that we're suspending it. Again, we're going to see illness. We're going to see it spread through. We want to minimize that. So this is an effort to minimize that process.
But the question is, you brought this up before, they are contagious even before they display symptoms. When did the student first start displaying symptoms, and is there a concern it might spread?
This individual had symptoms back when they came back from Mexico. They have been out of school for the time being, so that's why there's not a worry that there's any spread from that individual right now. That individual is actually recovering well and is not exhibiting symptoms at this time.
So that person never went back to school?
No.
Coming back from the vacation?
The individual was in school. Yeah, they had mild cold-like symptoms, and a lot of people will go in school. This was before our reminder that when you're having illness and sickness, you should stay home and not be out there. That's how we know things spread around. We've not seen anything, though, Barbara, with anything of any concern as of today in any of the absenteeism. North Kingston keeps very good absenteeism records. We've seen no change in absenteeism there or in the classes that this individual is in. Spring breaks. The 17th.
And when they first started showing symptoms?
17th.
So he was in school how long? 17th, 18th, 19th, just the 17th?
I don't know exactly how many days the individual was in school, but the individual was in school some period of time. But we would expect to see anything if there was any. Let me say this: the direct family members that this individual lives with, none of them are ill. All of them traveled with this individual. They all live with that individual. They've been back for more than 7 days. As you know, the incubation is 7 days. None of them are ill. I am not concerned about that spread at this time.
Just to clarify,
Time out, just a minute at a time.
when were they in Mexico, just to clarify the time frame?
Over our school holiday spring break in the state.
When was the school holiday spring break?
I believe that was the 10th to the 17th or something thereabouts.
Is that correct?
The week prior to the 17th, correct?
Do we know which region of Mexico they were in?
No, I do not.
Are the family taking counselors?
No, they're not.
Are any contact persons taking first?
No, they're not. We don't have any evidence that there's any illness at this
Nobody's
time.
manifested any symptoms.
We don't even know. Yeah. No one in the country is being quarantined. Quarantining is not a process that is being worked. If people are sick, we recommend they stay at home, and that's what we're recommending out there.
So as far as the confirmation from the CDC, you would expect that within 24 to 48 hours of today?
Usually it's been turning around 24 to 48 hours. They'll be getting the sample probably either late today or tomorrow. But they are getting overwhelmed with the number of samples down there. So I would expect it probably sometime as late, not until about Friday or Saturday. It could be later. That's why we're suspending it until we get the information back.
And it's just for one school that is being suspended at present?
Correct, just the high school. Felice?
How many students in the high school?
Approximately 1,600.
Police. There wasn't anything extra about last night. We have been in regular contact with the schools, sending out daily recommendations and reminders for them to do that because we want to make sure everyone is vigilant. We know that this is an issue that goes on. So that was a purely coincidence. Wait a minute.
We did ask, I think, starting over the weekend, to start Monday morning, all the schools to start reporting their total absenteeism rates, because we're looking to see if there's any bump. You know, there's going to be a lot of illnesses out there, and in particular, we're interested in anyone who has any influenza-like illness that's out there.
When did you get the tentative test result that suggested this could be is that today?
Sometime very late last night. Our lab people are working pretty much around the clock trying to get tests done. So I think we got it sometime late last night, and we started to collect additional information this morning.
What sort of test is that? Is that a blood test?
The test for influenza is a swab test, either from the nose or the throat.
Doctor, are you or your agency or any of the other state agencies doing anything differently than we're doing yesterday?
No. I mean, we continue to, as our agency, we're doing something different in that we've got a lot of people devoted to this. But from that standpoint, no, none of this, and I would not recommend they do anything different at this time, other than people should be more vigilant with what the normal recommendations are that are out there of stay home if you're sick, cough into your elbow, and use alcohol hand gels and wash. I'm sorry? This is an ever-evolving issue, particularly when you see early numbers with anything. The statistics are always going to be changing. We won't really probably know that for some time.
You had the infant, the 22-month-old, all right, in Texas and Houston that just died. All right. Now that, as I understand it, what's been reported, that's a Mexican family that had driven across the border to get help for the youngster in Houston. And clearly there are people, that are dying in Mexico. They recorded that flow. So far, we have not.
You are an advocate of closer, and certainly in the administration, I know. When people are blaming
These are coming. This is the swine flu. It appears that the epicenter of this is in Mexico, but people have gotten this. The people that have now contracted it, the confirmed cases, are Americans that traveled there. All right, so this is not an immigration issue. It's an issue of coming in contact with the strain of flu here and the way it is spreading. Larry, you wanted to make. It would be better, unless you want to do it, for you to get face to face with David and go through all of these things in detail. All right, okay.
First of all, and it's difficult to hear back here, but I believe I understood you say, Doctor, that you would expect the results by Friday or Saturday of this week?
Yes.
Yes.
And will that information be posted on any available website?
Yes.
Yeah, if we get confirmation, as soon as we get confirmation, positive or negative, that we will inform people immediately.
Yes.
And finally, is there any, you talked about applies to the schools at this point, is there any purpose to considering tailoring or reducing other activities within our town? No. Other community
No, as I said, right now, Flo asked the question, what are we doing differently? And, what we're doing differently is this is the first case, because, let me reiterate, Dr. Gifford is saying they've tested over a dozen, all right? This is the first one we've had that did not test as one of the classes of normal flu, i.e. needing more further testing out of CDC. The coincidence of this family having traveled to Mexico and the fact that it's not one of the ones we normally see is saying we want to make sure. So it goes there. That's the protocol. And they'll identify the strain, and we'll get a confirmation one way or the other. We are, because of the confluence of both of those things, in an abundance of caution, taking the step, because if it's confirmed to be H1N1, then the CDC's recommendation is the school be closed for a week. We're not doing that. But what we are saying is that, when you put the pieces together, you would say it looks like a greater likelihood. We don't know. It may not be. It may not be. But in an abundance of caution, we're just saying, let's suspend school for the next couple of days till we see what we've got.
So it is confirmed North Kingstown schools will be closed even next week?
For a week. No, for 7 days. The high school, not just the high school, North Kingstown High School. Under the CDC protocol, the high school or any school is closed for 7 calendar days, yes. Right? 7 calendar days, if they've got a confirmed case, yes.
I told a lot of students Monday from URI who had been in Mexico, on their spring break, and they weren't aware of the situation, and when they became aware, they had already said that they were sick. And I'm thinking, would it be wise for the state to compel anybody that was in Mexico at this particular time to come forward? I mean, there's several groups.
Let me
sororities that were there at the time.
No, is the short answer. The individuals who are not exhibiting symptoms, there's no test for whether they have influenza or not. So we're only recommending individuals who are having illness. Now, we also know that this is going to be coming, and so it's just a matter of time. And again, we are trying to do what the right thing is for people to be healthy, and the right thing is if you're sick and mildly sick, you stay at home. If you're sick enough that you feel you need to seek care, you should seek care and get treatment. If you have most people who have influenza symptoms usually going to call their doctor and ask them. My doctor has often told me to stay at home. I had influenza a couple of years ago, called my doctor. The doctor told me to stay at home, drink lots of fluids, and rest. Other times people are sick enough they may want to come in, so it is a decision they should make with their doctor. Yes, Barbara.
Just a clarification, this was caught because of the vigilance of the doctor who had seen this patient a week before and remembered that the person was sick?
Correct.
Can you walk us through that? The doctor heard about this swine flu?
The doctor saw the individual in their office, and the individual told them to, rest, plenty of fluids, and then saw the announcement over the weekend and said, person had influenza-like symptoms, traveled to Mexico, contacted us, and we sought the additional treatment and got the testing we sought additional testing and got the test results back late last night.
Doctor, are you testing usually more samples today than you were yesterday?
No. And actually, most of the states are shifting their recommendation over to stop doing broader testing and only testing individuals that are being hospitalized. And we've not seen any of that in Rhode Island. I don't have that data. I just don't, I don't know.
What was that? I'm sorry.
Any particular distinctions between the swine flu and the regular swine influenza?
Overall, the symptoms are exactly the same. Pretty much everyone gets a headache, fever, cough, runny nose. Then about 30% of the time, people will have a whole host of other symptoms, body aches, other issues. The only thing that's slightly different is that we see a little bit more nausea, vomiting, and some diarrhea. That's not a classic in that, but that, again, is only being seen in about 1 out of 4 people with the swine influenza.
You got to follow up, Flo. Wait a minute.
So on those that feel that there's more mild symptoms than normal, then they would be prompted to go.
Correct. Yeah. If I had a fever, headache, or cough right now, I'd stay at home, drink lots of fluids, and I'd call my doctor.
Wait a minute, Flo had a question.
Flo will come back to you. Yes, Flo.
What's the cause of death in case of pneumonia?
We're still getting that information out of Mexico. In influenza in general, and this appears to be acting like regular influenza, is people who are usually elderly or with chronic medical conditions or they're very young. They suffer those problems they have are more susceptible to complications from influenza, and that's usually what causes them to be hospitalized or have other problems from that. And that's what we're seeing so far.
Sean?
If you could just give us your analysis of its significance, just so we get the tone right, just to hear from you. What does this all add up to?
I think that there's clearly great concern by many people because we're seeing a new infection that's spreading across the country. And my experience and personal experience is people are always concerned when there's an infection out there. And so I think what I'm seeing in here is a lot of appropriate concern from the public wanting to know what's going on, what can they do about it, and they want to keep informed. And I think we've been trying to be as transparent as possible, get the information out as quickly as possible. And so this is the first case, and I think there's a lot of people's concern about a first case. I think one of the messages I have is it's coming, and the first case or not, we still need to be taking these steps out there. My concern is similar to everyone else. It's a new strain. We don't know how it's going to spread across the country, and that's why we're watching so closely elsewhere to get a sense what we need to be doing in Rhode Island. We do know we need to stay home if we're sick, use the alcohol hand gels, and cough into your elbow. It sounds simple. It's a simple mantra. I'm going to repeat it over and over again, but that's what needs to be done. It's hard to remember to do it.
Let me just also, Sean, I think the takeaway is this became a national focus when what happened in Mexico was reported a week ago. It's moved into the states, to Texas, into New York, and 2 schools now in California, and it's been reported. We, to this point, till today, in testing had not seen it. We don't know if we have it yet or not, but the point is with something like this, it is spreading. All right, so the first takeaway is that most likely we will have an incidence of it here. We may have it, we don't know until we get the results of the test, okay? So that's the first point, that people are hearing about it, they're seeing it in the news and reading about it, and they're going to be reading more about it because, I know Governor Patrick apparently had a press conference earlier this morning to say the 2 confirmed cases, and I think there were 3 others that are possible cases as well there. Second takeaway, and this is the delicate part, right now that we have not seen, what's the proper term, GIF? We haven't seen serious illness in most of the cases of the incidences. So it may be that this could be a different strain that we don't normally see that could pass through and be relatively mild. However, it could be something that's worse because it is a strain that we haven't seen. So it could manifest itself with more lethal consequences. So everybody is monitoring this. Dr. Gifford, CDC, all of the states, everybody, the Department of Homeland Security is just watching it every single hour, day in, day out to see. And all we do is keep our fingers crossed and hope that maybe this is something that will pass through, be relatively mild, and not a lot of severe consequences from it. But we have to be prepared and be concerned because there's a lot of unknowns in terms of the way these viruses behave, particularly as they begin to spread through the population.
Dr. Gifford, quick questions for you. One, if I understand correctly, the school at North Kingstown High School campus has a normal dismissal time this afternoon. Is that correct?
Yes, we're suspended. The superintendent suspended the school for the remainder of today activities and Thursday and Friday.
Is that typically at 2 o'clock? Is that correct?
Correct.
Yeah. Second question.
You said this was home
No,
No.
The students went home at 2 o'clock. Yeah.
And you said that you didn't know when the individual first contacted his or her doctor. Do you know when the onset of symptoms began? Exactly.
The 17th.
17th. Is that when they returned to the U.S.?
Yes.
In terms of vaccinations after, is there for those of us that have been given already, there's nothing for swine flu as of yet?
Because this is a new virus. There's no vaccine at this time.
And for those who so choose to actually want to get a regular influenza shot, even though it's late in the season, is that recommended?
It is not recommended. It's not clear there's any benefit from it. It addresses very different strains in there. So.
Mr. Thornton, can you tell us how you advise parents?
At approximately 2 p.m. today, we actually sent out a Connect Ed message to all parents, echoing the health department's guidance in terms of watching for symptoms from the children and certainly contacting their physician if they have any symptoms. Connect Ed system is a computerized system that will send out a message to all parents via email or phone, and that was done at approximately 2 p.m. today. Canceled.
What's the level of concern in the school?
We're obviously concerned, and that's why I'm here, and we're taking all precautions. Well, I haven't talked to any parents yet, but I can tell you I've been standing here and my cell phone's been ringing around 20 times, so I will get the reaction when I leave this podium.
Okay? All right, thank you. All right, thanks, Gifford. Okay.
Yes.
And you were just listening to a joint news conference with Governor Don Kachiri, Dr. David Gifford from the Rhode Island Department of Health, and also Superintendent Philip Thornton from North Kingstown Schools. And if you are just joining us, want to quickly recap the situation for you again. A student from North Kingstown High School being tested and monitored for the possible swine flu. Further testing, of course, necessary. We do not know that this is a confirmed case yet again. We should be hearing the results from the CDC in about 24 to 48 hours. School department officials have suspended classes at North Kingstown High School for the rest of the week. And of course, you can stay with Eyewitness News for continuing coverage of the swine flu scare. But the very latest for you tonight on Eyewitness News, beginning live at 5.
For more on this breaking story, stay with Eyewitness News or log on to our website, WPRI.com.
Sell some stuff.